Ladies and gentlemen, good morning. It's an honor to be sitting here and speaking to all of you, trying to look at solutions for the inequalities in cancer screening across the world. So, what I'm going to do over the next 9 or 10 minutes is to introduce you to low cost solutions, innovative strategies, which are evidence based, which have been tried as randomized controlled trials in India. Just to introduce, 85% of the global burden of cervical cancer occurs in less developed countries, and the incidence rates being highest in Eastern Africa, Melanesia, Southern Africa, and Middle Africa. 9 out of 10 cervical cancer deaths take place in less developed countries, and mortality rates are again highest in Eastern Africa, Middle Africa, and Melanesia. Looking at India, we have about 123,000 new cases. You know, we have a very large population, and 67,000 deaths annually from cervical cancer. We do not have a cervical cancer screening program in the country for the simple reason pap smear screening, which is a world standard, is not feasible in India because of inadequate infrastructure, lack of trained human resource, logistic difficulties, and relatively high cost. The Government of India, the Indian Council of Medical Research, carried out a survey sometime back, way back in 1992 and again in 2006 to find out what it would take to provide pap smear screening for all eligible women in India. They came up with an answer that it would take us 10 years to provide a single round of pap smear screening to 25% of the eligible women if we were to multiply the existing pap smear facilities in India by 12 times. So obviously, it was a no-show. In the last decade, a number of alternatives to pap smear techniques and strategies have been tested. 3 randomized controlled trials have demonstrated a significant mortality benefit following cervical cancer screening by 2 alternative methods, namely vinegar or acetic acid and HPV DNA screening. Strategy number 1 is single round of screening, because lots of times we may not get the woman back for a second round of screening. So we probably have to do with just a single round of screening. A single round of vinegar screening followed by treatment in the test-positive women performed by trained nurses in southern India resulted in a significant 25% reduction in incidence and a 35% reduction in mortality from cervical cancer. This was published in the Lancet 2007. The vinegar screening test. Why the vinegar screening test? It's also a part of the colposcopy procedure in GYN. So visual inspection with acetic acid is a simple visual test, does not require a laboratory. Results are available immediately. Paramedical workers can be trained in 4 weeks, which means it is widely implementable in every single village across the globe. It's a simple test that looks like that. It doesn't take more than 4 weeks to train your primary healthcare worker, and once she's trained, she just has to identify the only one below that's positive. The single round of screening strategy we tried again, where we compared pap smear with the vinegar test and with HPV DNA test. This time, the vinegar test was provided by primary healthcare workers. This was supported by the Bill and Melinda Gates Foundation. Here we studied about 132,000 women. One group of women got the pap smear, the second group HPV DNA, the third group vinegar, and the fourth group were controls. This study concluded that a single round of HPV screening reduced cervical cancer mortality by 48%, whereas a single round of vinegar screening provided by primary healthcare workers or pap smear did not reduce cervical cancer mortality significantly. Looking at multiple rounds, if a single round is not possible, what kind of multiple rounds can we have with the vinegar test? Effect of 4 rounds of vinegar screening by primary healthcare workers, because that's really implementable, was a cluster randomized controlled trial in Mumbai, India. This was supported by a NIH R01 award. So we looked at about 150,000 women who were divided into 75,000 intervention and 75,000 controls, a cluster randomized study. This is the kind of setting, looks very similar to what you see in Africa. On the top left, you have the low socioeconomic dwellings. You have health education, and you can see how interested all the women are to know what's happening around, an informed consent. And once you get the people understand what you're talking about, once you get the communities understand what you're talking about, well, they participate in huge numbers. And you can see the participation rate in this study was around 90% for both the controls as well as the screening group. The treatment completion also was 86 and 72%. We had a quality control in between where 5% of all screened women were again retested by experts and we had a 85 to 95% agreement rate that converts to a Cohen's kappa of 0.84. Attrition is something which happens all the time, where a number of women fall out of the study, and we had a planned attrition of about 21.5 and 22.6. Conclusions of this study were that 4 rounds of biennial vinegar screening by primary health workers led to 31% cervical cancer mortality reduction. There was no overdiagnosis. For those who don't understand screening very well, overdiagnosis is a big problem of screening, where we end up treating people who really don't need treatment. Whereas when there is no overdiagnosis, that doesn't happen. And that's a serious problem in public health situations where you don't have enough resources. This is widely implementable, and if it is applied in India, which is currently happening, we have the Indian government is now taking up, as part of the non-communicable diseases program, 6 districts of every state in India are going in for a 2-year pilot where they would be testing all women with VIA or vinegar. And if that works, it would be scaled up to the national level. So if that happens, we can prevent about 22,000 cervical cancer deaths annually. And if we do the same for other developing countries with low resources, which cannot provide pap smear screening, then we could possibly prevent 72,000 deaths in developing world annually. So these 3 studies, they present 3 attractive options for cervical cancer screening in low-resource settings. Number 1, in situations where only a single round of screening is feasible, the best option would be HPV DNA testing. 2, in situations where adequate number of trained nurses could be deployed, the screen and treat, that is the vinegar screening followed by treatment. And 3, the third and most cost-effective and widely implementable strategy would be, for cervical cancer control in low-resource settings, would be 4 rounds of biennial vinegar screening by primary health workers. We published this in an opinion piece in Nature Reviews. I would like to thank all these wonderful people who work alongside to make this program a success, and of course, all women who participated, women and their families who participated in these studies, which made solutions available for poor countries like ours. Thank you.